Daniel Amen, take two.
Dr. Amen, what do you do?
So I change people's brains and I change their lives. I mean, ultimately, that's what I do. I'm a neuropsychiatrist. We have 6, now probably 7 clinics. We see little kids and old people, anybody where there's a concern that they're not functioning at their best, from little kids who have autism to old people who have Alzheimer's, people who have ADD, anxiety, depression, bipolar disorder, schizophrenia. But ultimately, what we do is we look at their brains and we do everything we can to optimize them.
How often do you look at people's brains when you're looking at this long list of big illnesses? How often do you find mold toxins are a part of the problem?
It's actually very common that we see toxic brains that we don't know what's causing them. And that's what caused me to get really excited about learning about mold exposure, because I would see what would look like a toxic brain. And I'm like, are you drinking? Are you doing drugs? Are you lying to me? And people go, no, I promise. And then I would like go to their wife, is he lying? And she's like, no. At that point, I went, something else is going on. And so what could that be? It could be an infection, it could be anoxia, it could be an environmental toxin like mold. And so I began asking, so when did your symptoms begin? And did you have a flood in your house?
How often do you hear the answer that says they have a water damaged building?
A lot. So I often hear that they work in a water damaged building or that they had water damage in their home.
About a dozen years ago, when I had my SPECT scan done, it came back. I was living in a water damaged home without knowing it, and it said evidence of toxic brain exposure. And at the time, there wasn't the connection made with mycotoxins, but it was profound to hear that there was a toxin, a magical toxin happening. So even before those days, your scans were finding this. How does a SPECT scan work?
So SPECT works by looking at blood flow and activity. So it's different than a CAT scan or an MRI. Those are anatomy studies. They show what the brain actually physically looks like. SPECT looks at function. It's a nuclear medicine study, so it takes a very tiny dose of a radioactive isotope. We combine it with a substance that's easily taken up by cells in the brain, and the isotope acts as a tracking device, or a little piece of light that we can measure, and it basically tells us 3 things. Areas of your brain that work well, areas of the brain that are low in activity, and areas of the brain that are high in activity. So good activity, too little, or too much. And what we see with toxic exposure, mold exposure, is initially it might work too hard, like there's inflammation going on, but then chronically over time, what we see is the brain actually looks like it begins to shrivel.
Did you get formally trained in environmental medicine as part of what you're doing?
I was not formally trained in environmental medicine. In fact, I had no interest in it and no idea as a psychiatrist I would need to pay attention to it. It was by having a depressed person who's got brain fog and cognitively impaired. The family doctor has basically said she's histrionic, she's faking. It's her way to get attention. And I look at her brain and it's toxic. And I'm like, well, why is it toxic? She's not drinking, she's not using drugs, what? And it was that what that caused me, if I really wanted to be a healer, to learn what was going on with her.
What do you do when a patient comes to your clinic and they say, I don't feel well, I've been exposed to toxic mold? What's your procedure with that person?
So what we do is what we call the Amen Clinic's method. We take really detailed histories, especially looking for when did the change occur and what was happening around that time. We then look, we do SPECT scans because we always say, how do you know unless you look? So we'll usually do one at rest and one while a person's doing a concentration task. We'll often get detailed labs because if your thyroid's off, you're not getting better. And then we take all that information to make a more specific diagnosis and treatment plan targeted to your brain. But sometimes when we're doing our process, we'll see what looks like a toxic scan. And at that point, we have to figure out what that is. Today, what we're seeing is toxic mold, but we're also seeing infections like Lyme, and it's rampant. So figuring out that difference is really important.
When someone has water damage, what are the specific areas of the brain or parts of the brain that you see the most problems with?
So when someone has water damage, what we often see is it will affect the basal ganglia of the brain. So it's one of the anxiety centers, but it integrates cognition and emotion. So they can be emotionally not right and have a lot of trouble thinking. And we actually see it global. So there'll be issues with their frontal lobes, impulse control, judgment, forethought, executive function, but also damage in the temporal lobes. And when the temporal lobes are a problem, mood instability, irritability, memory, learning.
Is this an all or nothing problem where people are exposed and they get really sick, or is there a small amount of exposure can create a small amount of dysfunction in the brain?
The level of damage we see and the level of problems related to that, actually, there's a concept I really like called brain reserve. It's how much reserve do you have in your brain going into the insult, whether it's a head injury or being exposed to mold, because not everybody who is exposed to mold will have the same level of symptomatology. Some people, they can really withstand it, and other people can just fall apart. And it depends on how much reserve or extra tissue function that they had going into the incident, if you will. So if your mother ate well, took really good care of herself, she fed you, lots of educational opportunities, well, you might have had a lot of reserve going into the exposure, so your symptoms weren't as bad as if someone whose mom was stressed, didn't eat well, they fell down a flight of stairs. So it's actually how was your brain before the insult that determines how much trouble you're going to have and how fast you're going to heal.
Is it conceivable that a person who's generally pretty healthy goes into a moldy environment or is exposed to mold toxins orally or just by breathing them, that they could have lower cognitive function even if they don't fall apart emotionally and things like that?
It's totally possible to be exposed to mold, to take your IQ from 130 to 115, so you're still normal. You're actually still pretty good normal, but you hate how you feel because you can tell that there's a big change and a big difference.
Have you actually seen IQ scores that fell from mold exposure?
You know, we don't routinely test IQ, so I can't say that,
Okay.
but people certainly have said, I'm not me,
Yeah.
even though they're still functioning in the normal range, but they're not functioning anywhere like they want to function.
That's my story. I'm not a low functioning guy. But I found that I could tell it was gone. And when I brought things back online, my IQ went back up. What does a moldy brain look like?
So my experience seeing hundreds of moldy brains is they look what I call a toxic brain. So a healthy SPECT scan is fat, full, even, symmetrical, beautiful. But the toxic exposure from mold, it begins to shrivel it. So it goes from this big fat grape and it begins to take on the shape of a raisin. There's a pattern I call scalloping. So rather than full, even, and symmetrical, it's bumpy, which means there's lower blood flow, lower activity across the cortical surface. It's not one you want.
If I ask about mold and weight gain and fat, is that relevant for the work you do?
No.
Didn't think so.
Well, it's relevant in the sense that, so if we think about mold exposure and weight gain, It's like, well, what's the connection? If you damage your frontal lobes and you damage an area of the brain called the basal ganglia, that's going to give you behavior problems. If you damage your frontal lobes, judgment, impulse control, organization, planning, forethought, learning from the mistakes that you make. And in our research on people who are overweight, they often have lower frontal lobe function because their decision making is not as good. And to be at a healthy weight in our society at this time, when so many people are throwing crappy foods at you that taste awesome, it's terrible, right? You're in a war and you make bad decisions. The basal ganglia is actually much more interesting in the sense where it houses the pleasure centers of the brain. How joyful you feel, how driven, how motivated you are to accomplish your dreams. And when the basal ganglia is damaged, you get sad, you get flat. It's what the part of the brain that gets damaged in Parkinson's disease, which is associated with things like depression. So people who have mold exposure often will make bad decisions, which then can affect everything in their health, including their weight.
Have you ever heard of mold rage?
No.
4 days ago, I was in a hotel room and I felt a little odd. It was in San Diego. And my contractor called and wanted to make the 5th change to plans that I've already finalized 5 times. And instead of my normal Zen, like, okay, let's solve the problem, I got insanely angry and I told him, could you just burn the thing down? I don't have time to deal with this right now, which is not how I would ever behave. I went back to the room, started coughing, and I looked and I took a photo of huge chunks of black mold that were all around the air conditioning vent. And I correlated my behavior with my environment. I moved to a clean room, I took some detox things, and I was fine a couple hours later. But I wanted to kill people for that amount of time, which is way out of character for me. That's an example of mold rage. So do you see the sudden rage in response to an environmental input in mold people?
So one of the areas that's also damaged with mold is an area called the amygdala. So the amygdala is in, underneath your temples and behind your eyes. Little almond-shaped structure that when that is damaged, people can have rage for no reason at all or little reason. And it can devastate their relationships, it can devastate their work, and people will judge them as bad when they're really not bad, they're sick.
Do people who have moldy brains feel responsible and feel guilty about the way they behave?
So people who have moldy brains hate themselves because they don't know why they're acting that way, and they don't understand it's medical, and so they assume it's moral, that they're choosing to act this way, and they hate themselves. I mean, the loathing, and their families hate them too, because it's like, if you loved me, you wouldn't be an asshole. It's like, why are you an asshole? And nobody knows. And the imaging has taught me that behavior is a lot more complicated, and it makes me more thoughtful, more forgiving. And when I see people act badly, I'm like, somebody should look at their brain.
What's the connection between environmental mold toxins and birth defects and autism?
There's a whole new field that is growing up in medicine that is horrifying us. It's called epigenetics, which means that your habits, but also your exposures, are turning on or turning off certain genes, making illnesses more or less likely in me, but on also generations of me. And most people don't know, when a little girl is born, she's actually born with all the eggs she'll ever have. And whatever she is exposed to during her lifetime is turning on or off the genes, not only in her, but also in her eggs, that are making illnesses more or less likely. And so environmental toxins like mold and lead and pesticides are being associated with birth defects and developmental disorders like autism.
If you had a choice between living in a house with asbestos and lead paint or a house with water damage, which one would you live in?
If I had a choice of living in a house with asbestos and lead or mold toxicity, I would go pitch a tent outside. There's actually great research when they took lead out of gasoline, the murder rate went down. So, I mean, they're all disastrous for brain function.
It's amazing how many people with mold toxicity actually do live in tents. I don't know if you come across this in your practice. I've interviewed some people like that because they can't find a clean environment. When they do go live in a tent, they get better.
So you wonder, I mean, have you like gone to New Orleans after Hurricane Katrina? My first thought with the hurricane is there's going to be mold exposure.
One of my friends, guy who runs American Air Testing, who's in the video, John Mira, owned property there. He abandoned his property afterwards as a mold expert. I intentionally won't go to New Orleans. If I did, I'd have to have a bag of cholestyramine and charcoal, and it would take me a week to recover with glutathione drips. I'm just not that interested.
What we do at Amen Clinics for people who have mold toxicity in their brains is one, a really good workup, partner with a mold expert, and then make sure we're doing all the things we can to repair their brain. And that means getting the environment cleaned out, getting their diet right, making sure they have the right nutrients. And what the exciting thing is when we see the damage is they're not stuck with that typically. And we can tell how much recovery is possible and scanning them 3 months, 4 months, even 6 months later.
Is Prozac an appropriate treatment for someone with a moldy brain?
So, it's a fascinating question whether or not Prozac is an appropriate treatment because a lot of people are depressed. And what Prozac does is it calms down brain function. So if you take a moldy brain that is already decreased in activity, and then you put them on an SSRI like Prozac, my experience, you can lower it further, making them more cognitively impaired, and it's possible actually to disinhibit them so they kill themselves. So I think you have to be very careful with the treatment that you give them, and we're passing out Prozac and all the SSRIs like candy in 5-minute office visits with the family practice doctor, and I'm horrified by that because often someone who's had mold exposure will go to the family doctor and I'm sad, I can't think, I'm not eating, I'm temperamental, and they'll go, oh, well, you're depressed, because they meet the DSM-5 criteria for depression, and on the antidepressant, they actually get worse. So I'm very concerned if you don't look, you don't know, and you hurt people.
What percentage of cases across all of psychiatry do you think might be correlated with or related to environmental exposures, including mold?
So we actually did a study of 109 consecutive patients at Amen Clinics and go, so in what percentage of cases would this scan change what the doctor did? Well, it was 8 times out of 10. And one of the most common things, so it was 10% of our patients, they had a toxic brain of an unknown etiology. And so I think it's much higher than anybody would ever imagine. But because most psychiatrists never look at the brain, they don't know it. They just don't know that it's happening. And these patients are being missed, mislabeled, and hurt.
So psychiatrists who don't look at the brain for things like mold illness are flying blind.
So of the 40,000 psychiatrists in the United States, very few of them look at the brain. So what that means is they're flying blind. And when you fly blind, you miss traumatic brain injury, you miss mold exposure, you miss other environmental toxins. And because you miss those, you misdiagnose, mistreat, and hurt people.
Do biofeedback and neurofeedback have any role in treating mold illness?
So when I think about treating mold illness, I think about 3 things. Brain envy, you got to start really caring about it. Avoid anything that hurts your brain. So now you have a vulnerable brain. So it means it's even more important to eat right. It's more important to exercise. So brain envy, avoid bad, do good. Eating right, exercising, and things like hypnosis, biofeedback, neurofeedback can be very important in the process of rehabilitating damaged neurons. I'm very excited about using technologies like that to help optimize brain function.
Do you think that the mold problem that we have today with damaged buildings and mycotoxins in our environment is getting worse or getting better or about the same since you became aware of it?
The biggest problem I see with mold is so few people know about it. And because few people know about it, very few people are ever looking at the brains of people who are suffering, that it is really the silent epidemic that is killing people's minds and killing their joy. And that's my concern. I don't know that it's any worse than it was in 1991 when I first started ordering scans, but I don't think it's any better because I don't think there's the consciousness or the awareness that if I have brain fog, I should look into it. Too many people have this little lie in their head. I can't remember anything, but I'm 40, that's normal. It's like, no, something's the matter, you have bad habits. I can't remember anything, I'm 50, well, that's because I'm 50. That's normal. No, that's because you've been exposed to something or you have bad habits. So, well, I'm 70. And, well, 70-year-old people have memory problems and brain fog. And I'm like, no, they don't, unless they've been exposed to something or they have bad habits. So it's never normal to have brain symptoms. That's not normal. It's the sign of trouble.
What other questions should I be asking you about mold and brains?
The most exciting thing that I've learned is if you had a moldy brain or a damaged brain and you do the right things for it, that there is a lot of healing that can take place, that you're not stuck with the brain you have, that with the right interventions, often, very often, you can make it better.
When people are exposed to mold toxins, what does it do for their sleep?
So when people are exposed to mold, it often really can disrupt their sleep. Most people don't know, but you need a fairly healthy brain to sleep right, to actually turn off the worries, the anxiety, the bad thoughts. And when it damages your brain, there's no ability to sort of put a brake on the anxiety people feel, and they can't sleep. And their sleep tends to be broken and erratic. And people don't know that if you don't get a good 7 hours of sleep at night, it actually turns off 700 health promoting genes. So it then becomes this really bad, vicious cycle. You're not sleeping, you're worrying, and then the next day you feel bad, but then your immune system starts to suffer the mold exposure because if you've not gotten it clean, your body can't fight it, you get more infections. It's a vicious cycle.
Does a lack of sleep make your brain more susceptible to mold toxins?
A lack of sleep makes you more susceptible to everything bad. It is just a critical pillar of health.
When someone is exposed to mold, what do you do to improve their brain?
So when someone's exposed to mold, it is absolutely critical we then put their brain in a healing environment. So the first thing, obviously, is get rid of the mold, right? I mean, you cannot heal if you're still being poisoned. So that is critical. And then it's critical to avoid any other things that are hurting it. And the problem is people aren't sleeping, so they're taking sleeping pills. Well, that's going to hurt the brain more. People aren't sleeping, so they're drinking more. So brain envy, got to care. Avoid anything that hurts it, drugs, alcohol, brain injuries, sugar, and then really start doing things to help it. So put your brain in a rehab environment, new learning, exercise, great nutrition. Probably the most important thing is making sure you're giving your brain the nutrients it needs to heal.